Dr. Rakesh Ji. Welcome to Love Heals Cancer and Onco.io. So this is a cancer healing journey talk where we invite speakers who have gone through cancer, maybe as patients, caregivers, or survivors, who inspired us before, who are going through the similar journey. This just not helps with the treatment, but also motivates and inspires them. And when they listen to these journeys, it actually helps them a lot with the treatment. So thank you for giving out your time for this. It's an honor to have you with us. So can you please start with your journey, how it all started?
Thanks for giving me this opportunity, ma'am. It's a very kind of moment. The more number of patients can be welfare after watching this in my mom's same stages. Today I'm going to share you some or more details about my mom, which he faced and what are the struggles we faced, how we had come back towards her journey, cancer journey. Due to that corona starting stage on the my mom was found with cancer with CA endometrium. The type of cancer is CA endometrium. It was about third C2. The stage was third C2. On the time there was we cannot able to do and go for hospitals for sudden due to the corona was on the peak. We are from South Zone of Tamil Nadu, named as South Zone. During that time, the hospitals managements, many of them has refused. We will not go and take treatments due to corona. Limited patients only allowed. So we have neglected many struggles. After that, only my mom came back. I like to tell you a single thing. Cancer is just a disease. First, you need to have a good source. You must know. Okay. My mom had a cancer in his nearby his uterus. The named as CA endometrium. The stage was third C2. In the starting stage, we taken an CT. Then we gone for chest. Then we had taken whole body scan as PET. We found that majorly disease was not spread. It was only near the ovary and uterus only. Then we gone for chemotherapy plan. It was around 4 cycles before surgery. Paclitaxel and carboplatin. We have done 4 cycles, 28 days. Once we have done for mom. When we are putting the carboplatin, paclitaxel, it will suppress the bone marrow. It will decrease the platelets like that. It is a common factor in that medicine. You need to make arrangement of blood. If your patients in B positive, O positive, what kind of blood group you should maximum it may require up to 3 units. You should have the 3 units donor prospects at time. We cannot know the which time they can need, which time they cannot need. Like that, we cannot suggest anytime they can need. According to their platelets increase up and down, like that the doctor will suggest for major. On the time, the COVID time, I have struggled a lot because of donors arrangement. I have not taken treatment in my city. I have gone to other city because of due to corona increase. I faced towards where the corona the patients are in lower level. So I moved towards like that districts and taken treatment. So I have faced a lot of struggles for arranging donors like that. After that, we have done the surgery and we have removed the uterus and the ovary, and the mass size was about 4 cross 3 centimeters. It was huge. Prospectively, it was huge. Doctor said, let me go, then we see, like that they told. So okay, no problem, sir, anything can happen, no problem. Just go to curative intent. I have told to doctor, and doctor also so supported me. I have supported to doctor also. Then the surgery has been done. Then we have left above 4 to 6 weeks. Then we completed again. Doctor suggested to go for another 3 cycles to 4 cycles of chemotherapy to reduce the mass size. Again, we cannot able to remove the additional mass, which it was merged with some nodes, lymph nodes. It is caused as lymph nodes. It will be around the left leg to upper abdomen. The mass size was about 4 to 3. It was debulked, but it was not fully able to debulk due to the it was arrested some nodes. And then we gone about 2 to 3 cycles of carboplatin paclitaxel again. On the time we have faced an issue due to the operation, she can't take more foods. Yeah, if we are taking chemotherapy, we can't able to take fruits like that. It will always you would the vomiting sensation. They will have some severe pain like that. It's a common factor. So no one should worry about that. If you are a cancer, being a cancer patient, you should not worry about that. Next we faced what are the things means during after the surgery we faced consulted 2 to 3 doctors what about the radiation and what are the types of radiation. I have suggested going towards 4 to 5 doctors about what type of radiation can be kept. They suggested me the BMRT, IMRT, VMAT, 2D, 3D dimensional, and cathode ray tube, CRT type. There are more number of type. According to the cancer, they have the treatment will vary about the radiation. My doctor suggested it to go towards VMAT. Then I considered with 2 to 3 doctors. They also told VMAT is an best option. After completing the chemotherapy, I gone to VMAT. It was my mom taken towards 31 cycles daily, 10 to 15 minutes must for weekly 5 days, and weekend we go for an chemo as called as cisplatin. My mom taken 50 mg. According to body, the mg will varies, and also the type of cancers during the radiations. We have completed the 31 cycles successfully, continuously 31 days. After that, we have taken a PET scan and seen there is a metastatic state. What is mean metastatic state? It can be spreaded to any other parts easily, like that known as metastatic state. It was moved towards autocaval. Autocaval is in between two kidneys. The area will be affected, known as autocaval. There can be affected possibilities is available. Our doctor suggested. So we gone for internal radiation. It is a cylindrical brachytherapy, HDR. It is known as HDR, higher dosing rate, HDR. And then we have given 2 dose. It is not spreaded to other. It has a possibility to spread to over any barrels in the body. So we gone to internal radiation. Doctor suggested just maximum 3 cycles can be given. Just we have given 2 cycles only. It's enough, doctor told. Then we gone towards the 2 cycles weekly once. 2 weeks we have completed weekly once. For if I have given 1 cycle, then we have we put at rest out for next 6 days. Then for a cycle, then put at rest for 6 days. In between the tablets, and if the blood will be decreased, the HB point, we should monitor at least monthly twice for each and every cancer patient. Before surgery, after surgery, during chemotherapy, we should need complete the CBC count, HB, platelet, the things which are all we need must check at a time for a month, at least twice a month. It was sure it will avoid some major problems. In the month of January this 2021, I faced a problem with my mom. After surgery, I have left 1.5 months. I told before the 4 cycles of chemotherapy, we need, if surgery is done, we need to give 6 weeks of time gap. After that only we need to start next the thing. If we are starting radiation, we need to give 6 weeks of time, then we will go for operation. Like that, every due to if we are giving a cancer treatment, we must give 6 weeks gap for every treatment. If a surgery is done, it will be have some pain like that, it should be arrested. The pain relief must be done for the patient, then only they can tolerate the next thing. So only their doctor is suggesting to give 6 weeks. On that 6 weeks, what I faced means the blood platelets, everything has been low due to I have not have the knowledge to take monthly to at least twice. I left her with 1.5 months without any blood count. Probably on the January when I done the first chemotherapy, the totally due to the chemotherapy side effect, totally the HB platelet, everything has to be became low, known as thrombocytopenia. Everything suddenly decreased means the disease known as thrombocytopenia. Nothing around that. So then we transfuse blood, the whole blood. Then we packed cells like red blood cells like that. We packed cells. Everything has been diffused day to day. It taken more than 30 days to recover to take her comeback. After that, I regularly used to go 1 or twice at a month, repeatedly the CBC count. If the CBC decrease, I will go for a doctor suggestion. If a HB alone decreased, you should not go directly towards putting our red blood cells. If a red blood cells is transfused, automatically the HB will rise. Before that, you can put iron sucrose. If the iron sucrose is an injection, it inserted into your vein. If it is inserted properly into vein, the HB will automatically increase. You should not directly go towards putting blood. First, you can go for this. If it has not any proper improvement, then you can go for putting a whole blood or red plaque cells like that. In case the other factors like platelets, any other way, you can bring back the single donor like that, or already you can buy a packed cells. It's available in many blood banks. Then you can transfuse it. Mainly, you should concentrate on foods. You should make vitamin D like that, vitamin B, vitamin C like that. You're taking papaya, papaya leaf juice like that. Everything which are the platelet increasing foods you must take. In case they having any pressure or glucose factor like sugar level is high like that, it happening means you should monitor them with a higher peak. I'm having a own CBC monitor and HB monitor nearby hometown. Yeah, so it's more comfortable me to check. If I call within 15 minutes, the person will come. They will check within 15 minutes. The report will be on my hand. Like that, if you are having a cancer patient in home, you should make arrangement of these kinds of steps. And if a thing is happened, you should have the report within. For other patient happening 2 hours means you should have minimum at least within 1 hour. So you can have a prevention. The 1 hour will help you to increase the lifespan of the patient. In any surge matters, it is going any problems like that, it will help you to diffuse the one. Each and every minute is a priceless moment for a CA patient is in these stages. Then the mom is considered with they have taken foods, mainly foods. We have given the eatable vegetables like soup like structures. We have given this play. We have not gone with syrups. We have fully gone with herbal item like syrups with platelet rich like that. Syrups are available in many medical shops, Ayurveda medical shop. We have gone throughout that. And vitamin D, vitamin C like that, we have not taken towards tablets. We have taken towards the fresh juice items. If the blood automatically decrease, I used to regularly give pomegranate juice. It helps to improve the level of HB. I have seen it directly seen it in towards the moms when he suggested was day to day increasing, and when it was reached a peak time. Now after this all completion, now the HB was 13 point. Nearly I am having 15. My mom having 13. If a woman, it should be around 12 to 14. For a man, it should be around 15 to 18 HB level. It's a good personality in blood. If they are having the which they when I according to ask to my the blood donors which they are giving, they have told me the HB level. They having a good body standard like that. They have told me. For a man, it should be a 15 to 18. For a woman, it should be a 12 to 14. you should have at least 3 donors on every time. If you called, if you have need to if you need any blood kinds of stuff, if you should have 3 donors simultaneously on your hand. If you call them, they should surely come and give. Like that, you should make arrangement on every time. If blood is given by one donor, you should make arrangement of another donor. Every time you should have 3 donors on your hand. Then what are the things I have faced? Means in doctor's arrangement, due to the bed lackages, due to the COVID times, the maximum number of patients, cancer patient must have taken the treatment. I have to gone towards 300 kilometers. I have gone for taking my mom's treatment. I have stayed there for 2.5 months. Then only I have treated my mom after surgery. Then one day I came back. The corona have slightly decreased day to day. Then I have taken treatment over my home native itself. Then the radiation completed, then the internal radiation completed. Now mom is fine and she recovered from cancer. Never gone to the stage 3 to stage 4. The limit thing is what I'm telling to each and everyone is how far we are taking the step, it will save her life. Each and every cancer patient, I like to say this kind of stuff. Again, what other things mean? I felt I have seen many patients in where my mom was treatment. It used to be a friendly network, and still now they have speaking with me. They have told me these kind of steps out there. Many of them have suggested many things to me. We are taking treatments for past 5 years, past 7 years. They are gave me some encouragements. Being a single son to my mom, I faced many of struggles in money, motive, anything it can be. But they have told me no problem, she will be okay. Like that, many of the patients attended told me, you don't panic, everything will be okay. Like that, they have told me. Today it has been done. So I am telling you each thing. If you are a cancer patient, don't left your belief. One day you will come back. That should be on your mind. That is the only one thing it should be on your mind. Then one day you will come back. It will be surely done. So each and everyone, please place it in your heart. Ma'am, enough, ma'am.
So, may I know how your mother is feeling now after the treatment is completed?
Ma'am, you need to record or?
Yeah, we are.
Any other questions? Okay.
How is your
ma'am? Tell me.
I was just saying that how is your mother feeling after the treatment? How is she doing right now?
Ma'am, before treatment, when she find she is suffering from cancer, when she used to be not able to do her self things at all. Now she came back and doing everything. They showing the which she is preparing food for me daily, day and by day. She is preparing food for me daily. She thoroughly come back. But the one thing we are sustaining daily. I'm monitoring her BP and sugar level at least twice a week. I'm having my own glucose meter and the pressure monitor at my home. It helps me to check at least twice a week. And if pressure increases, I will consider go to doctor and suggest they will give me some tablets. If I give, it's okay. But she was not able to do before the cancer what the thing done. Now she can't do, but she is recovered for 75% due to now only I have completed treatment on the 3rd month. So it takes some times now. She was around 63 kg before the treatment started. Now she was around 55 kgs. She have the 8 kg slabs. Now step by step the kgs are improving. So she will be back soon. But she was constantly saying the major things is she was not struggling anything. She was acting like a normal people. It's not a problem. The day and day moves, but she was doing her everything which she done before the cancer is spotted on him. Now she is already doing day by day the things which he done before. It's same thing she is doing now.
Okay. So when you got to know about the news that your mother has cancer, how did you and your family, go through this news? Because it's very shocking to know that someone in your family has cancer. So how did you take it?
Ma'am, I had consulted with doctor, ma'am. When I had a CT scan report, I have advancedly considered to a doctor. It is a progress. It is a symptomatic like cancer. Let we go towards PET scan, then we'll confirm. Like that doctor told, and then it has been confirmed. Finally, it is a cancer. Then I have told to my father it has happened. My mom and her mom's sister and her mother also had a cancer, like same stage. My doctor told it is a genetic, it may come towards genetic also. I don't feel it is only in curative intent. Doctor fully supported me. It's a curative intent only. You should not fear on that. Just follow my instruction and do the needs. She will be okay one day. Like that, my doctor told it. Hold the thing goes to my doctor only. My father felt out and done many things. What we going to like that told. I faced everything. I faced, and according to doctor's suggestion done, everything is okay now, ma.
Yeah, so it must have been very emotionally tolling on you. Like, how did you feel at that time?
Mama, it was too. I have towards my job pressure also. It's my mom. I can't tolerate the thing, ma'am. I have gone. It always used to cry. What are the things gonna happen? But I have fixed one thing. Before my mom, you should not have a single drop of tear in from your eye. If I have a tear, my mom will become lapsed. So I have melted my heart and started my journey towards mom. And I now it was mostly completed. Till date, I have not had a single tear from my eye towards my mom. If I facing my mom, there is no single tear. Till now, it was. If I have a tear, I will go on alone. I will cry. After that, I will come to speak to my mom. That only happened, mom.
I think that's very good that you kept your mom strong all the time, because it's very important that the
Yes,
patient
ma'am.
is feeling positive to get the treatment. So when she
Yes.
was treated, she had many chemotherapies and everything. So were there any side effects that she faced after that, after the treatment?
Ma'am, according to the side effect, as per already I have told, the HB improvement is will be never there will be an improvement due to if you are taking a chemotherapy, the HB will be and always become low due to that drug effect. HB platelet everything will be decreased according to the food which we take. It may majorly increase decrease may be happen, but if you transfuse some blood, it will be okay. We should not give over food like if we are giving chemotherapy. She always used to take some vomit symptoms like that. She will have some pain, like literally she cannot swallow the food. If you are giving her to eat, she cannot swallow due to it will like the taste was sucking like, right, like she will like to tell to me the taste was not like good draw, please don't give me this. It was horrible to tell how the taste was. It was not like good, like that she usually used to tell. Then I have had a medicine from Ayurveda medicine. I don't know what is in English. In my mother tongue Tamil, it's known as Al Pokoda Palam. In my Tamil, I don't know what is the name in English. If we the Siddha doctor suggested me, if we give that it will be like a date only. If you give the date for 5 minutes, able if you keep her on mouth, after 5 minutes, make it her split, then it will be give some sweetness to swallow the food like that. The Siddha doctor suggested. Then I have given the food. Then she used regularly used to eat before taking food. She used to swallow the alpacoda. I told that no. She used to swallow. After that, she used to stick. Then she can eat. It will come give some sweetness, so she can normally intakes.
So it means that apart from the normal treatment, you also took help from some Ayurvedic and herbal treatments as well.
Ma'am, I have considered with them, ma'am. Ayurveda herbal items, it always is a useful thing. It was naturally grown. Ayurveda is a naturally grown. By considering for taking food items, I have suggested towards Siddha doctors. So the Ayurveda items also taken to increasing the sustained levels like HB, platelet. Like that, I have gone towards the Siddha doctors.
Okay. So lastly, if there is any message, any parting message to everyone out there going through the same journey of cancer, you were a caregiver to a mother, so you must have gone through many things. So what is that one message that you will give to others who are going through the same journey?
If you are a cancer patient, due to drug of chemotherapy, you will have face some hair loss. That is the main thing. My mom, she never looked at the mirror for the past 1 year of treatment. After that chemotherapy, the radiation, everything has completed. The hair has grown. Now she was looking at mirror for the past 1 year. She never seen the mirror. So please consider, you will come back one day with the same progress which you have faced at any time, at any step. You can move on. Okay, be strong at any time. It will melt you, but you should be strong at any time. It was the one thing I have seen in major hospitals. Many of the patients will have will they do not have hair like that due to the chemotherapy side effect. They do not have hair. If you are willing to for hair donation, just you should have at least 7 inches for making a wig for small children who are surviving for in cancers like blood cancers like that. If you are donating around 14 to 16 inches, it goes to a well-grown woman. So please donate your hair at least once in your lifetime for a cancer patient. More number of cancer patients like my mom, they are facing many troubles without having a hair. So at least do at least one time in your lifetime as a hair donation around 7 inch or 14 to 16 inch. Many of them are collecting towards regional cancer centers, and many trust and NGO groups are collecting and providing free wigs for many cancer patients. Please do. Thank you.
So thank you so much for sharing your journey, Ramesh ji, and I'm sure it was very informative and it will help many people who are suffering with cancer, and it has motivated also a lot because your mother is cured now and she's doing better day by day. So thank you so much for giving your time and sharing your journey.
Okay. Thank you so much, ma'am.